And good morning, everyone. Excited to hear what news you have to share with us on what State of the Union for Oscar Health Plan. So I'll turn it over to you.
Thank you so much. I appreciate it. Let me give me a moment here while I share my screen. All righty. Thank you, Mr. Gallardo. Quick introduction of myself. My name is Christian Gallardo. I'm a senior sales executive for Oscar Health. You see the resemblance here in last name. For those of you who don't know, Juan Gallardo is actually my father. So worked with iPros for 4 years. I know the iPros team very well, so I'm really happy to be here today and give you all the update on what's going on with Oscar for this OE. As far as our sales team, as I mentioned, I'm the senior sales exec for the state of California. I do have my counterpart, Jesse Hendon, who is the sales director for the West Coast region, as well as our central and northeast regions as well. So quick reminder for those of you that have been selling Oscar, or perhaps this is the first OE where you get appointed with Oscar. I want to give you all a reminder of what exactly we do. And to put it really simply, we're a tech-first health insurance company, and our job is to make sure that we save our members money and we keep them happy while doing it. And so that approach has really been successful for us over the years. We're a fairly new carrier compared to the rest of the market, but we've had a lot of success. Last OE, we actually surpassed 1 million members, which was a huge accomplishment for us as we continue to grow nationwide, expanding into different counties and states. And that was preceded by us actually going public on the New York Stock Exchange as of March 3rd of 2021. So from a broad strokes view, I know we're talking about California today, but I want to talk a little bit about where we are in the country. So we are in 19 total states this year. For any of you that are selling nationwide, we have an update. We are no longer offering insurance products in Colorado and Arkansas. Reason being is there's some deeper regulatory requirements that unfortunately meant that we will no longer be offering products next year. So with that being said, we are also not expanding into any new states for this OE, but we are expanding into some more counties in the current states that we're in. We're servicing almost 500 counties nationwide and 3 different product lines. So we have our ACA product, or IFP product as it's known here in California. But we're also offering Cigna plus Oscar, which is taking off here in California as well, as in addition to several of the other states that we currently offer products in, and Medicare Advantage. And then, of course, as a company, we've been able to grow over the years. So been working at Oscar almost 5 years now. And when I started out, I think we were at about 1,200 employees. So we're continuing to grow. We're at 2,000 employees, and a large bulk of which are actually located at our Oscar hub, which is out in Tempe, Arizona, where we house our customer service team members and several of our other departments. So today I'm going to kick us off on how to use the broker portal. So as you know, if you've sold Oscar, our broker portal is at business.hioscar.com, and a great resource for you all to do a variety of things. You can quote and enroll new business. You can open up current policies that you've sold and print ID cards. You can manage your own commissions by viewing your statements and statement amounts. And of course, it allows you to double click into your members on whether or not they're using their Oscar perks. And so we made an update as well to this year. So as I mentioned, you can view your individual book of business. You've been able to export that book of business in the past, but this year we're updating it. So you will be able to view contact information and account creation status when you downloaded that CSV file directly from the Oscar portal. And as far as how to search doctors and drugs, you can do that directly through the portal. You open down the main menu. There is a search doctors and drugs option. And in California, you just simply select the coverage year, the coverage access, and the coverage area. And that should get you everything that you need to search any prescriptions or current providers that a potential member is currently with. And of course, we're continuing to make it easy to make a payment at the point of sale. Most important part of closing it out is making sure that policy is effectuated by the effective date. And so if you're selling through Covered California, there is a pay now option. You will be able to click that link and you will be prompted to fill in all the necessary information as it's shown here on the screenshot to the right. And we do allow you to make payments on behalf of the client during the enrollment year as well. So that won't be through Covered California. You can go directly to the broker portal, open up the individual book of business, and open whichever policy you are trying to access. And from there, you can go ahead and click the billing and statements area where you can upload either the ACH payment information if you want to set them up on autopay, or make a one-time payment if necessary. I do want to note that we are continuing to only offer credit card through the exchange and only for the effectuation or binder payment. So that's that first payment that actually effectuates the policy. And again, only through Covered California. Now for commissions this year, we've made an update. We are changing our commission structure. It will now be $15 per member per month for first year business and renewals. It is not vested. So if you did have business with us previously, that is renewing with Oscar, it will begin to be paid at the current rate, which is $15 per member per month. As far as bonus, unfortunately, we will not be having a bonus this year. And moving on to your resources, as far as broker support team goes, of course, they're available to you for a variety of things. If you need any commission escalations, escalation with enrollments, assistance with creating your broker account, even just letting you know where our forms and resources are for benefits and networks. You can contact them at the number listed here. It's 1-855-OSCAR13. You can also email them at brokers@highoscar.com, and they're available 5 a.m. to 5 p.m. Pacific Standard Time. For resources, we have highoscar.com/brokers. We've made an update to our look this year, so it'll be easier for you to find everything that you need, whether that's SBCs within the plan document section. You can do any provider search from this website as well. You can even register for any events that we currently have in the docket for California, or if you're selling nationwide, obviously we have all of our states available through there as well. So these are the two links that we highly recommend you bookmark for selling Oscar. Just as a recap, you need any type of resources whatsoever, plan and network documents, registering for events, downloading marketing materials, that's all at highoscar.com/brokers. And if you're selling through the broker portal, if you want to check out your commission statements, you want to update your account information, that's all done at business.highoscar.com. Here are our plan and benefit partners or national vendors for this year. So we partner with CVS Caremark. They are our national pharmacy benefit manager. That is our primary pharmacy. We do have a couple of exceptions, a couple of mom and pop pharmacies as well, but we just simply recommend that members use their Oscar app or the Oscar search tool to find in-network pharmacy location. We also have mental health benefits that we partner with and offer through Optum. And we do offer pediatric dental and vision. That's through Liberty Dental and Davis Vision. And we have two preferred in-network lab partners in Quest and LabCorp, and that should cover the majority of locations, given that these are the two largest lab institutions in the whole country. All right, now moving on to our plan and network deep dive. So as most of you know by now, Covered California plans are standardized, which means it doesn't matter if it's Oscar or another competitor. When you're shopping through the exchange, if you purchase a silver plan, the deductible is the deductible. The max amount of pocket is the max amount of pocket. It's the same across all carriers. So really the way you differentiate yourself is through the experience itself and the network of doctors that you have. And so in an effort to do that, we are an EPO. So that means being able to see any of our physicians in LA and OC without the need for a referral, which is a huge convenience. You're not having to wait 2, 3 weeks, 30 days to visit your specialist after you get your referral from your primary care physician. Obviously, that's a huge advantage for us. And of course, we also have Oscar Care, which is our customer service experience. So you get all of these great perks like virtual urgent care options at $0. So being able to get access to a physician at zero cost, obviously from the comfort of your home or wherever it is you'd like to take a call, that's always available to our members as well. Okay, so looking at the network, we do have some updates for this year. So last year, we had two networks. We had a dual network option in LA and OC. Those were referred to as the Choice and Select network. This year, we're making a change. We're consolidating both of those networks. So there will only be one singular Oscar network. The key changes and the only changes will be that in LA County, we will no longer have UCLA or Cedars-Sinai in network. They will no longer be a partner with us effective 1/1/2023. We are sending out member notices to all of our members, letting them know of the changes so that they can make any renewal changes as necessary there. And in Orange County, again, given that we're consolidating the network, we will no longer have UC Irvine. However, we still have great options to choose from in LA. We have Providence St. John's, Providence Tarzana, USC Keck, which is, of course, a nationally ranked hospital. A lot of great options. And in Orange County, we're anchored by St. Jude and St. Joseph in the northern Orange County area, which are great institutions and asked for by name. And if you're selling in the Bay Area, we do also sell products in San Francisco and San Mateo. We partner with Dignity Health and UCSF Medical Centers, both great hospital systems up in the Bay Area. All right, so moving on to the Oscar app and account creation, because again, we're a technology-first health insurance company, and these are some of the ways that we save our members money throughout the year. So when it comes to account creation, we really want you all to mention this to any of your potential or current Oscar clients, because it allows them to do a variety of things. They can pay bills, they can search for in-network care, they can speak to their care team, and they're all able to do that either through the app or within their account. And through the app itself, you get a couple of other high value add perks, like being able to earn $75 per calendar year for hitting daily step goals. It's as simple as download the Oscar app, connecting it to your smartphone device, whether that's Apple or Android, and you essentially earn $1 for hitting a daily step goal per calendar year. So great little perk for our members to log on and get used to using the Oscar app. Of course, other things available through there, you can find your member ID number. You can also have this application available fully translated in Spanish. That's huge for us. We want to make sure our Spanish-speaking cohort are getting the same experience that our English-speaking members across the country are getting as well. Moving on to another big announcement for us. This year, we are highly recommending that you select a PCP. Again, we are an EPO. We're not an HMO. We're not requiring you to choose a primary care physician, but we do believe that in doing so, we are going to be able to better manage our members' healthcare throughout the year. If you do not select one, as you see here on the screenshot to the right, you can skip for now. However, we will auto-sign a PCP in California. Again, you do not need to visit this PCP. If you decide to choose another one, you are able to do that at any time. And you will not need a referral to see a specialist despite choosing PCP. This is just in an effort to make sure that we're better managing our members' care throughout the year and giving them access to a primary care option in person. Okay, so moving on to our virtual options. So we have virtual urgent care. Some of you may know this as Doctor on Call, as we previously named it before. This has been updated to virtual urgent care as of last OE. And it's a really great perk. You're able to speak to a board certified physician in as little as 15 minutes. Process is super easy. It's going to be $0, available at any time of the day. And the only exception for that $0 copay is HSA and catastrophic plans. In the event you do have an HSA or catastrophic plan, it will be a $15 copay. However, all of the plans will continue to be at $0. Now, our care team experience, this is our customer service experience, and we really pride ourselves in our customer service. When you compare us to other carriers, especially if you've been with another carrier and then been with Oscar, you'll notice the difference immediately. I mean, our Oscar care team is one of the largest portion of our currently employed employees. They answer a variety of questions, insurance plan questions for individuals that are confused on what a copay is, what is my deductible, what does that mean, what is a maximum out of pocket. So they're there as a resource for our members to be able to make sense of a really confusing health insurance and healthcare system that we currently have in place today. They also can help with pre-procedure preparations. We have them available in Spanish as well, but we also have live interpretation options for over 180 languages as well. And they're super great at their job. As you can see here, we have objective stats to prove that they are, they're able to answer phone calls in under a minute, which is great. I know I've been with other carriers, and I know if I need to call customer service, I better get ready to be on hold for 30 minutes to 45 minutes, even an hour in some cases. So again, we staff our customer service reps to the point where we're able to lessen that wait time for members calling in for with questions. And now talking about culturally competent care. So we started this initiative last year, and this is an effort for us to address the healthcare disparities that exist in different racial groups, ethnicities, languages. So in doing so, we've created a list of accomplishments that we've currently done or are working on in order to address those concerns. So we've collected provider data for thousands of providers, including race, ethnicity, and language. I'll touch on what we've done exactly in the next slide. But we've also launched corporate giving programs. We are currently pursuing the NCQA multicultural healthcare distinction. And of course, we're continuing to pilot new member experience initiatives year over year to make sure that all of our members are getting the exact same level of care that we expect to offer them. As far as the updates on what we've been able to do, on our search tool, we now have a tab for race and ethnicity. So in the event a certain member would like care that represents them, that they feel more heard with, they'll be able to do that and filter by race and ethnicity. For PDFs, we do have this available in English and a variety of other languages. So we have a melting pot of communities here in LA and Orange County. So that being said, there are handouts in Spanish, Vietnamese, Korean, Mandarin, Russian. So if you have members out there that speak another language as their first language other than English, you have the availability of these PDFs to share with them to learn more about Oscar from their perspective. With that, that's the end of my presentation. Happy to open the floor up to questions if anyone has any.
Christian, what does the future hold for California? Do you guys see yourself being here for 2023, 2024 and beyond?
Absolutely. There's a huge commitment to the state. This is the third largest ACA market in the country. And so from that perspective, we absolutely are committed to the state of California. And although we've made some couple of tough changes this year, this is all in an effort to be more competitive next OE and beyond.
Yeah, Oscar's been a very valuable partner from the beginning. So, and California is our core market. So I know from hearing from our agents, I think they just want to make sure that you're still going to be around with the news that we're hearing in other states like Colorado. So to put their mind at ease.
Yeah, absolutely. I think, unfortunately, there were some regulatory requirements in Colorado and Arkansas, but when you look across the country, we're now at 1 million members. We grew, I think, by 250,000 members last OE. So the growth is there. People do love Oscar, and we're continuing to make sure we operate as an efficient insurance company. So we've had to make some tough decisions, of course.
Well, we appreciate the transparency. We didn't have as many agents as we wanted to attend. I know since we cross-sell with Medicare, I know a lot of agents are certifying for Medicare. They're getting ready for AEP, but we are going to make an effort to reach out to every single one that's contracted with Oscar. Make sure that they have a copy of this copy of this session, a recorded copy of the session, so that we can get their insight and address any concerns that they have. We do have a few agents on the line here with us, so encourage you, if you have any questions, to post them. Otherwise, look out for a call from iPros. Any questions out there?
And thank you for sharing this this session. I appreciate it. And if there are any, other questions, concerns, comments, feel free to forward them over to me. I'd be happy to go ahead and chat with anyone.
We'll do that, Christian. Great job. Thank you for the information, and we'll be getting back to you with more information. I do see. Okay, no questions from Jamie Ramirez. Thank you, Jamie. Appreciate you, Christian. We'll be in touch and follow up with the other agents.
All right, it's been a pleasure as always.
Thank you.
Thank you so much, and thank you to everyone that joined today. I really appreciate you all, and looking forward to working together this OE.
Thank you. Bye-bye.
All right, bye.